Melanoma is a type of skin cancer that is characterized by dark, asymmetrical patches of skin that grow over time. In melanoma, melanocytes, the cells responsible for creating pigment in the skin, begin to multiply faster than they should. Melanoma starts as a small, thin tumor, less than a millimeter thick, and is contained right on the border between the epidermis and the dermis layers of the skin. As the tumor grows, it begins to expand upwards into the epidermis cells, and then downwards into the dermis cells. And as it grows deeper into the skin, it eventually reaches the lymphatic system. Once there, tumor cells can break off from the main tumor and hitch a ride through the lymphatic system to other places around the body, allowing the tumor to spread to other organs. The diagnosis of melanoma is based on the combination of symptoms and biopsy results. The mnemonic ABCDE is often used to help with identification of potential melanoma spots. A stands for asymmetry. Melanomas are not symmetrical. If you were to draw a line through the middle of a melanoma, one half of the spot wouldn't be identical to the other half. Often the asymmetrical shape is pretty obvious. You might even see pillar-like shapes breaking off from the main body of the spot. B stands for border. Melanomas have irregular borders, which means that the edges of the spot are not sharp. Instead, they gradually fade in and out. C stands for color. Melanomas can appear as several colors, including blue, red, black, brown, or gray. The color is often not uniform either, with the skin changing color or shades throughout the spot. D stands for diameter. Skin spots that are larger than 6 millimeters, which, for reference, is about the diameter of an eraser on a pencil, might indicate a melanoma. That said, this isn't a hard rule, as melanomas can be smaller than this. E stands for evolving. Melanomas change over time. Their shape, size, and color can all change over a few weeks to months. The spot might get bigger, or it might stay the same size, but some other characteristics might change. Melanomas, especially in later stages, may have other symptoms too, like bleeding or itch. Melanoma is primarily caused by exposure to UV light, like the sun or at tanning salons. This is why many public health agencies recommend using sunscreen regularly to reduce UV exposure. However, and you might find this interesting, very few studies have been done to determine if sunscreen actually decreases a person's risk for melanoma, and the research that has been done has been inconclusive. Get subscribed because we'll be releasing a video soon that dives into this literature a bit more. But to summarize, if you're a white person, you probably should be wearing sunscreen. But we just don't really know if the sunscreen will prevent melanoma. That said, melanoma can occur on parts of the body that are not exposed to UV light, such as the palms of the hands and soles of the feet. If you're a person of color, you're more likely to get melanoma on these parts of your body. Melanoma has also been linked to people with immunodeficiency, as well as people with some genetic conditions like xeroderma pigmentosum. Melanoma doesn't affect everyone equally. White people of European descent are the most likely to develop it, whereas people of color are up to 30 times less likely to develop melanoma. If you're interested, we have a video that digs deeper into these racial variations in melanoma incidence rates. We've left a link in the description. Where you live in the world also increases your risk for melanoma. Now, you'd think the further you live away from the equator means that you're exposed to less sunlight, and in turn, you're less likely to develop melanoma. But when we look at the data, that's not what we see. And that likely has to do with the color of people's skin. People with darker skin colors typically live closer to the equator. The pigment in their skin acts as a protective shield from the UV radiation of the sun, making them less likely to develop melanoma. As a result, countries where a lot of white people live have higher rates of melanoma, especially if white people live closer to the equator, like in Australia. If melanoma is caught early, patients can be cured by surgically removing the affected skin. Pretty much everyone who catches melanoma early survives. But if melanoma is more advanced, patients might need more aggressive treatments, such as chemotherapy or radiation. Survival rates for these patients drops significantly depending on how far the melanoma spreads. So, in summary, melanoma is an aggressive form of skin cancer that can be fatal if left untreated. It's diagnosed based on a number of visible characteristics and confirmed with a small tissue sample being tested in a lab. Exposure to UV light over decades is the most common cause of melanoma, and white people of European descent are the most at risk for developing the disease. Melanoma can be treated by surgically removing the affected skin if caught early, but may require intensive treatment if caught at a later stage.